Ladies and gentlemen, we now have our presenters in conference. Participation in this presentation is by express written invitation of the AHA only. Unauthorized participants and or any party that aids and abets such unauthorized participants may be subject to criminal and civil penalties under both state and federal law. Please disconnect from the call or log off the webinar if the AHA did not expressly invite your participation. Please note that you may submit your questions and comments at any time using the chat pod located to the right-hand side of your webinar screen. It is now my pleasure to turn this conference over to Elisa Arisbakachaka. You may begin.
Thanks so much, Chantal, and thank you everyone for joining us. I'm really excited to bring you today's webinar, Physician Wellness, a self and system imperative in a value-based model. And really excited today to have to present the team at Medisys Health Network. And with that, I'm going to turn it over to Bruce Flans to introduce his team. He's president and CEO of Medisys and just a wonderful human being. And he's got a great team with him. So Bruce, with that, I'll let you introduce the team.
Alyssa, thanks so much, and thanks to the AHA for affording us the opportunity today. So with me today, I have Dr. Sabia Raouf, our Chief Medical Officer and Patient Safety Officer here at Medisys, Dr. Alan Roth, Chairman of the Department of Family Medicine, Ambulatory Care, and Community Medicine, Dr. Gina Basillo, our Vice Chair of the Department of Family Medicine, and Dr. Kamika Lewis, one of our faculty attending physicians in family medicine and also a certified mindfulness and emotional intelligence instructor. So this is not intended to be a commercial for Medisys, but rather just to give you a little bit of perspective. So for contextual purposes, Medisys Health Network is a small healthcare system located in Queens County, New York. Queens is the most culturally diverse of the 3,000 counties in the United States. The people of Queens County speak 135 different languages, and our 6,500 employees are very reflective of the community and speak about 100 of those languages. Queens has about 2.3 million people. Medisys has a couple of hospitals, one of which is a level 1 trauma center. Both are teaching hospitals, along with a long-term care facility and very extensive ambulatory care, where we provide about 750,000 outpatient visits a year, which is very critical to what we do, since we take full capitated risk on 143,000 individuals. To give you just a perspective, if you can imagine the city of Syracuse, New York, which is the 5th largest city in New York State, that population of Syracuse is 142,000, so we're essentially taking full responsibility for all the healthcare needs of a population essentially the size of Syracuse. At the bottom of this slide, you'll see our payer mix, which is 60% Medicaid, 60% Medicaid, 20% Medicare, 5% uninsured, and 15% commercial. The commercial isn't true commercial. There's a lot of workers' comp and no fault. So there are not very many opportunities to cost shift, and you can see this is a very challenging financial payer mix. Our network has many of the same challenges, I assume, as the facilities that you're associated with in terms of limited supplies, but being safety net hospitals, I think our challenges may be a little bit more unique than the average across the country. We focus significantly on the social determinants of health because of our commitment to our capitated patients, which represent about 50% of our total organization's revenues. And with this dynamic healthcare landscape that's changing because of all the advances in technology and pharmacology, the pace of change has created some real challenges. But throughout it, we are focused on the patient experience, which we believe is very much linked to the provider experience. So every organization's got its assets. Many have financial assets. That's not one of ours. Our greatest asset is our human resources. Our average team member has probably been with our organization for about 25 years. They've bought into our mission and feel fully engaged in what we do, and we hope that we offer them many opportunities to contribute to the mission of the organization and to the well-being of the people that we serve. This slide is critically important, and I would encourage you to please be mindful of what it says. These are the healthcare priorities, the wellness priorities, and I always tell our team you can't screw it up, so the order of priorities has to be your health, your family, your job. You need to be healthy in order to be good to your family and good to your job, and you need to be happy and content in your personal life in order for you to be fully productive in your professional role. So now it's my privilege to turn the next set of slides over to Dr. Sabir Raouf, our Chief Medical Officer. Thank you.
Good afternoon. It's a pleasure to be presenting this webinar today with my wonderful team. And today I would like to discuss a little bit about my personal journey and then discuss why provider wellness is so important for me. I came to this country as a foreign medical graduate, and after fulfilling all the requirements to apply for residency, I decided to choose radiology, one of the most competitive fields to get into. Even today, we do not have enough females in our subspecialty. After finishing my residency and fellowship, I started my first job at Jamaica Hospital, and 22 years later, I'm still here at Jamaica Hospital. At the time I started, I had two young kids, a 3-year-old and a 6-year-old. Soon after I started here, I was appointed the chair of radiology. I worked very hard to build quality departments at both our hospitals. And if this was not enough, as soon as I settled in my job, I diagnosed myself with breast cancer. So I was a perfect candidate for burnout. Why did I not burn out? The organizational structure and culture allowed me to have the work-life balance and provided me with the flexibility that I so much needed at that stage of my career. I did not have to change my priorities or give up my values for my work or my family in order to succeed professionally. I was allowed opportunities to grow and thrive within this organization. The wellness priorities that Mr. Flans just spoke about are really encouraged throughout this organization. My leadership supported me, and they validated the contributions that I was making to my departments and to this organization. They saw potential in me, which even I did not know I had. And I've spent these 22 years in this hospital really doing meaningful work that is giving me pleasure and joy. Today, as I am the Chief Medical Officer and a physician leader in this organization, I would like to give my providers and every team member a similar experience. I want to nurture an environment where they can have meaningful interactions with the entire care team and reduce bureaucratic burdens for them. We want to recognize and we want to appreciate our employees who are doing so much for our patients. We want to design a workplace environment that will nourish and sustain them and maintain their vitality. We want to create pathways throughout our organization which will help our providers deal with everyday stresses and burdens. Being a safety net hospital with limited resources, as Mr. Flans just explained, we have to be creative as we restructure our workplace to promote provider wellness and resilience. As you listen to the rest of this webinar, you will realize that some of the programs that we have created did not cost much, but are extremely helpful for the well-being of our employees. Having top leadership make wellness their priority has had a positive impact on the satisfaction and well-being of our employees and for our employee retention. We do not claim to have solved the issues of provider burnout, but I'm extremely grateful that our leadership has started thinking about ways to prevent burnout in our organization. I hope you will find this presentation helpful and applicable to your settings. I will now pass it on to my two colleagues, Dr. Gina Basello and Dr. Kamika Lewis.
So it's really great to have our leadership speak to the importance of wellness because that support and that buy-in within the organization, that impact is really invaluable. And so what we're going to talk about now is why is this focus on wellness necessary in our healthcare system today? As you all know, there's an epidemic of burnout within our healthcare system, and it's defined by three main categories of emotional exhaustion, depersonalization, and decreased personal accomplishment. And so what does that look like in clinical practice? You can see here, sorry about that, you can see that I'm not sure how much longer I can keep going like this, really seeing that emotional exhaustion being expressed. What's the use? My work doesn't really serve a purpose anyway. Really starting to say then I used to feel so connected to my patients and now they just feel like numbers. So feeling that depersonalization. And recently, all over healthcare articles, journals, the research is now showing that burnout is really a public health crisis within our healthcare system. And it's really being seen permeating through every part, from the student level to resident, attending, to the leadership. They're now seeing it in administrative areas as well, and nurses definitely have been showing a high rate of burnout as well. In terms of for attending physicians, there was a recent last year publication by Medscape, and they did a lot of research and saw that within just 3 years, the rate of burnout went from 45.5% to 54%. And really what the research is showing is that burnout is threatening patient safety, the outcomes, quality of care, satisfaction, and compliance. So it's not only about the providers, it's also the impact that it's having on the rest of the healthcare system. There's a higher risk of medical lawsuits and provider self-reported errors. There's a higher mortality ratio in patients that are hospitalized when their providers are burnt out. And we're seeing that attending physicians are having the highest rate of suicide of any profession, and more than twice that of the general population.
Thank you, Kamika. So we are fortunate at Medicis to have a senior leadership that supports really designing the work that we do around not only quality and wellness for our patients, but for our physician team as well. And so we've looked at now the definitions and the scope of burnout. And everyone's pretty familiar with that at this point. And if we look at the sources of burnout, it's easiest to sort of break them up into systemic factors as well as individual or human individual related factors. And some of them, when you look at this list of systemic factors, are pretty widely known and talked about. The challenges of working with an electronic health record, the complexities of a high workload and volume demands with an increasing clinical complexity as things shift towards outpatient. So when they're in the hospital, they're a higher complexity to deal with for everybody. But then there are those other factors that don't necessarily get the attention that they deserve in light of how much they impact wellness. We call them well-being disruptors when we talk about it. And those are the things like when the roadblocks become the norms in your everyday. Think about your day and think about some of your most frustrating days. What causes the most frustration? When things that are supposed to go a certain way don't. Those things kind of disrupt and there aren't clear pathways, and that's what Dr. Raouf was talking about and looking towards really allocating our resources, though limited, to smoothing the way for the work that we do every day and keep learning continually. The professional isolation also doesn't get a lot of attention. You know, physicians are muddling along trying to deal with all of these challenges, and it becomes a lonely sort of endeavor. And when we sort of give some space to that, we kind of find out all sorts of things. And we'll talk a little bit more about that culture of silence as we go along. When you look at the human individual factors, the old way of talking about burnout was to say, okay, the humans have to, we have some susceptible folks and they have to be trained to be a little bit more resilient. But we see now that we've learned more that those human factors have to do a lot with some self-selecting qualities of physicians, that those personality variables serve their patients well, but not necessarily their wellness. What do we mean? We mean things like there are norms around expectations that are so high from yourself and other physician humans that you just have this philosophy of having to keep going regardless. And in our environment, ambiguous success can be a real big factor. Things like where you had a real great visit with your patient, your diabetic patient, and you connected around having them have an aha moment, but yet their A1C is still 13 plus. And how you define that success is going to impact how well you are as well. So if we look at our medical culture in general, there is this stigma around seeking help, and that, you work when you're sick, you work it out yourself. Perhaps when you complain, you might be considered whiny or suppressing feelings, and continuing around that culture of silence was and still is, in some regards, the cultural norm in medicine. So when we talk about the culture of silence, you think to yourself, what are the factors in your institution that are the real system disruptors of well-being for your team? What's the stuff that everyone knows is there that no one knows what to do with? And finding and addressing those sources, even just one simple one, like ensuring that a non-physician role can fill out the parts of the many, many forms in our regulated system that kind of cause a burden. Those are the ways we can ease pathways that make a big impact. That's a way of showing each role that they're valued for what they can impact the organization with, and that's going to make a big difference. And when you think about the scope and implications of physician wellness, the quality measures are clear. The patient satisfaction, the patient outcomes, these are all intuitive. There are financial implications, and it will have something to do with workforce specialty choice, recruitment, retention. We've already talked about patient safety and errors are increased. And on a personal note, there are mental health issues and relationship difficulties that must be talked about. One of the things that is unique in the way that we look at things, we have our value-based model, and we care for the most vulnerable and underserved patients. We're happy as an organization like ours that people are now giving space, and the dialogue is around the identification of the social determinants of our patients' health and well-being. We kind of think of it similarly, and if you look at, here we are at the Safety Net Hospital. If you think of it as, in our culture, we have social and financial determinants of health care. And these are the things where we have to look at them to be able to really address sort of wellness and optimize that satisfaction for our team. So, for instance, we kind of look at, we had an example of this last holiday weekend. Here we are, a holiday weekend. We already know and we anticipate that there will be changes to staff, and just like there always is around holidays. One of the ways that this is operationalized in real life is we know that the resources are what they are. We also anticipate when times will change how that workload need is demonstrated. So, for instance, looking at what we saw last year in terms of volume, we changed our pathways this year. We altered and enhanced the way we distributed the information about the allocation of those resources towards a more seamless sort of pathways for the work we do on our high volume, high demand times. Otherwise, the risk is those limited resources end up fostering and lending themselves to a philosophy of survival mode silos rather than the collaborative, integrated approach that will best serve our team and our patients. And again, this quote kind of from 2013 looks at where it's really pointing out that the origins of burnout are not linked to just the personal characteristics of a few susceptible people, but that it's rooted in the environment and care delivery systems that we're all working in. and that it's pointing out that the policymakers and the organizations have to address this problem, not just for their physicians, but for how it will impact their patients and their bottom line as well. And we're seeing that even on the medical education level, as a teaching hospital and as a residency program in family medicine, here we see that the medical education system at both the medical student level and the residency level is now regulating a focus on wellness from early on. So really this slide is depicting that it's all connected and interrelated, that each of the members of the system is dependent on the other for success. And if one is compromised, all of the others will be as well. So if our patients are unsatisfied, nor will our physicians be, and the rest of the team and the organization will suffer as well. And the same can be looked at in reference to focusing on positive changes in each of those areas. So we have to look at ways to address all of them.
And so now we want to discuss how to go from that place of burnout to wellness for everyone. And this talk is definitely focused on physician wellness, but when you're looking at the bigger picture of physician wellness, you can't just focus on the physician. You have to make the environment around them well as well. So, how can you bring everyone from the whole organization as a whole from a place of emotional exhaustion to a place of vigor and enthusiasm? How can you bring them from that depersonalization back to a place of connection with each other and with their patients? How can you bring that sense of lack of impact back into achievement and meaning? And so really what we're trying to do for the organization is, not just bring them to a place of managing burnout, but teaching them how to avoid burnout and then even be able to foster wellness within the organization. So for us, the elements of organizational wellness that we started to apply can be broken down into different steps. And as we know, it starts with the leadership commitment, and we've already spoken to that at the beginning of the presentation. But what we've also started to implement is mindfulness, emotional intelligence, psychological safety, mutual understanding, team engagement, values alignment, and wellness champions. And these are the core things that have been implemented. So we've heard a lot about mindfulness all over the news, and what really is mindfulness? And it's defined as putting your attention on the present moment and being able to be aware of what's going on with you, the people around you, but from a place of curiosity and kindness and not judgmentally. And oftentimes you can show up to a meeting and you're there, you're physically at a meeting, but how often are your minds in the past? You're thinking about what happened in the past and you're worrying about the future. And so really just learning how to be present where you are and also have your focus there as well. And we're seeing that that's really vital to creating communication and team environments within the organization because a lot of times when you show up places and your thoughts are all over the place, you're not really connecting with people, you're not really hearing what they're saying fully, and oftentimes you're not even able to explain yourself as well when your thoughts are kind of racing. So just learning how to be present and be able to be fully present in the environment you're in. Mindfulness research has exploded in the last decade, and what we're finding is that there's a lot of research now showing the benefits of mindfulness. It's really improving your overall cognitive function. It will increase over time when you do mindfulness practices, it increases the actual size of the gray matter concentration in the brain, more specifically the prefrontal cortex, and decreases the size in the amygdala. That's the area associated with worry and anxiety and depression and stress. That part shrinks, and actually the prefrontal cortex, which controls how you function in everyday life, that part gets stronger, and your ability to have self-control and self-management improves. This also, mindfulness has also been shown to lead to enhanced communication, increased self-awareness, and a significant decrease in job burnout. The next factor that we found was very important is once you have that foundation of mindfulness, you can then bring in emotional intelligence. And emotional intelligence is really being able to be aware of what's going on with you, having insight, a sense of insight on what's going on with the people around you, and then being able to make decisions from that place to see what the best solution in that situation is. And the four main areas of emotional intelligence are self-awareness, so understanding what's going on with you, how you're feeling in an actual moment. A lot of times we go on automatic pilot, and we do these reactions instead of, actually really stopping and thinking of the situation. We kind of have these autopilot reactions, and it prevents us from being fully present where we are. Then, once you're able to find some self-awareness with yourself, you're able to be more aware of what's going on around you, and then you can start paying attention to, hey, I didn't actually realize that person was frustrated. Why are they frustrated? And then you start to have that curiosity, and you bring that into the conversation. And once you have those skills cultivated, you then can go into that relationship management piece and really be able to have great collaboration, to have good communication. And that leads to you also having self-management skills where you're able to now control your emotions, you're able to control your reactions, and you come from this place of awareness. And what we're seeing is that the research is really showing how emotional intelligence is vital for workplace team environments. Leads to increased team performance, decreased occupational stress, improved decision-making, reduced staff turnover, increased personal well-being, and increased leadership ability. So what we've done here at Jamaica Hospital so far is we've been able to establish wellness champions in different departments and at all different levels, not just the physician level and the administration level, at nursing levels and staff levels as well. And they've had leadership series for the leadership of the organization, both hospitals. We've had wellness curriculums for certain residencies for the residents. And I was able to provide a 2-day training on mindfulness and emotional intelligence to our leadership over the last 2 years through an organization called Search Inside Yourself, which is where I'm certified through. But we've been able to really bring those tools to our leadership because we believe it has to be a top-down approach. The top has to buy in and be an example for those underneath them. We also were able to provide monthly meditation and massage for our employees, and a monthly knitting group, which when I first saw, I thought was a little strange, but actually the research on knitting is very good. It's actually right there with meditation, so really is helpful for mindfulness. And so really just being able to change, to use the strength that providers have, physicians have, of, and healthcare employees overall, they usually have a sense of service. They want to be helpful to others. They, very compassionate people. They want to strive for excellence. And so taking those positive values and preventing these negative potentials that can happen when you're burned out, and then bringing them the skills and the tools to take them from those negative potentials and burnout factors into to positive outcomes using reframing, self-compassion, self-awareness, generous listening, which is vital, and being able to connect and have community instead of being in a silo and feeling like you're all alone. So the next topic we'll talk about is psychological safety and its importance within any organization. And so in 2012, Google sought out to figure out how to create the best team. And they had over 130 teams at the time, and they wanted to see what are the people that we have to put together to create success. And so they had a lot of theories and thought that it would be something about their education level or the background level, and interviewed thousands of people. And what they found was that none of their hypotheses were correct, and that the number one factor for a successful team was psychological safety. It wasn't who was on the team, but how the people on the team connected with each other and interacted with each other. So psychological safety implies that the team members are able to feel safe and take risks and be vulnerable in front of each other. Really being able to say, hey, I don't know if this is right, but I thought about this. Does that work for you? And if it doesn't, that's okay. There's no shame involved. There's no guilt involved. It's just you're able to speak how you're feeling. Other factors they found to be very important for team success was dependability, structure and clarity, meaning, and impact. But by far, psychological safety was the #1 factor. And things that lead to psychological safety in an organization are role clarity. That's vital. People often get very stressed out, burnt out when they're not clear what their role is within their team. Being able to have support systems for the team and peer-to-peer interactions. Feeling that there are interdependent roles and that people will be able to help you and you can help them when different situations arise. Being able to have continued learning. And feeling that your leaders are involved and that you're having positive leadership relationships and not punitive ones. And when you're able to establish that within a team or an organization, the benefits that come from that are that people are no longer afraid to share with each other. They start speaking to each other. Problems, things that could have been a problem, get caught ahead of time. And you're able to see that the organization and the teams are starting to have more satisfaction. They're seeking to learn more. They want to be more skilled. They're more engaged. And just by being more engaged, they're having better outcomes and seeing overall improved performance within the organization.
So in shifting towards looking at psychological safety, which we are clearly very passionate about, and there's actual literature behind it, what does that look like on the everyday? Where do you see that in an organization? And we're going to talk a lot about some examples of what we do here on the everyday and how it all ties into our joint mission of wellness for our patients and for our team members. So what does psychological safety look like? Transparency has been found to be a big part of that. And Google talks about it, like Dr. Lewis was saying. But here, how do you foster psychological safety through transparency? While you share information, you involve the team at all levels, and you diminish fear by ensuring that everyone knows how issues are handled in a transparent way. And the easiest examples to think about from our organization is our daily safety huddle. Every day at 10 o'clock, leaders from all areas of the organization and every department get together and huddle around what happened yesterday, what went well, what are we doing today, what to expect. And as we've been doing this, we've seen that more and more, based on how it's handled when someone brings something up, we've actually created a lot more psychological safety, and people are much more willing than they were in the very beginning to just say what's happening so that we can collaboratively deal with what goes on. Similarly, we have revamped our interdisciplinary team rounds every day on the floors, and that has lent itself towards a lot more transparent sharing of information and problem solving collaboratively. That's what psychological safety tends to look like in the everyday. We use data. When you use data, you demonstrate why decisions are made, which then impacts with an increased sense of trust from everybody. We're now well underway through our quality department of moving towards standard departmental dashboards. What that does is it makes expectations clearer, it makes monitoring clearer, and it just lets there be no mystery as to why decisions are being made. And encouraging creativity. You know, we sit in our leadership meeting and Bruce says to us, okay, we all need to solve our own problems. And so we kind of pose an area of the day. We're in the middle of flu season, so we've had some significant challenges there. And we creatively problem solve and brainstorm. And the more psychological safety there is, the more people will be willing to take a risk because it won't be a risk to say what your ideas are. So the goal of all of these factors is to try to achieve mutual understanding. Mutual understanding is going to let optimal outcomes happen. And what does mutual understanding take? It requires a sense of common values, and those values have to be clear and known and universal. People have to be willing to achieve mutual understanding, and with mutual respect, clear and transparent communication, we can achieve that. Ensuring that the whole team knows what's most important. So here we are in our value-based model with high quality, low cost, and the team has to be given the instruction, and they are for us, where if they choose what's best for the patient when there are competing demands, they know that that is what's going to be supported. And Another concrete example for us is our hospital-wide PI plan is centered around pillars. Those pillars are the core values for our organization, and as we standardize that language, it creates a lot of clarity and trust for all of our team members. When you look at physician engagement, and we heard from Dr. Raouf, who has focused a lot and fortunately for us been given the latitude to focus a lot on physician engagement. Physician engagement, we kind of modified an older model that we saw where if you think about the stages from a version where something is posed to physicians and their first answer is, that's absurd, right? The change mentality that occurs. Or, oh, it's not going to matter what I think anyway. What we want to do is when you put together that trust and that increased transparency and psychological safety, folks are going to be more apt to be able to live with that and support it, and they'll consider changes and engage differently. And then if we get to engagement, well, now those folks and their creativity and their problem solving are now sort of something that will benefit everyone in the organization. So we have to think about that when we recruit and when we think about retention. We've done a lot of work from trying to find folks that share our mission sense of our organization and serving the underserved. And our CMO, Dr. Raouf, one example of engagement on this level would be our young physician, or I think they've told us to call it rising physician now, collaborative. So some of the earlier on in their career physicians are engaged from the senior leadership right off the bat to ensure that their needs and their perspectives are made valuable and actually show them that we are using their input to sort of feed back into our pathways. So we have a bunch of ways that we have looked at all of these things in our organization. And some of them we'd like to just share a little bit more about. When we talk about engagement, this is a teaching hospital. So the ASPIRE program, and some of us really like our acronyms, our ASPIRE program stands for Aligned Safety and Performance Improvement Resident Engagement. And if you see the domains on the bottom there, they're really aligned with everything that we're talking about. And we know, anyone who is in a teaching organization, that those residents and nurses in the trenches, as we call it, are the ones that are really where the work needs to be able, that's where the rubber hits the road, so to speak. So instead of having all of our wonderful initiatives not get to that level, we develop a program like this where we teach our resident learners where the work that they do every day lends itself and is aligned to our organizational mission. We teach them the key principles of improvement and safety. It helps us foster that transparency, and again, we provide them tools for engagement and empowerment. Some of our recent topics were around root cause analysis, the informed consent process, how physician communication weighs in as a quality metric for the organization, and we even engaged in a very large dialogue that was unprecedented around a showing of the documentary Do No Harm, where it was focused on physician suicide, and we've seen a lot of improvements come just from that broader dialogue, including wellness hotlines and assistance programs for our residents. Another initiative that we do is the Schwartz Rounds. We're fortunate enough to have Schwartz Rounds as part of our organization and our team approach, where we are able to come together in a protected space and engage in an interdisciplinary dialogue. We have some of our key cases. We'll have a panel present that case and then talk about the experience that those team members had in caring for the patients. And this is what's unique about Schwartz Rounds is it's a way to sort of engage the team and decrease those feelings of isolation. They're rounds that are not centered on the patients, they're centered on the team members. People get to have an increased sense of appreciation for the other roles and contributions, and it gives people a forum to actually have their social and emotional insights sort of facilitated and explored a little bit more. Another model that we ascribe to is the Just Culture model. The Just Culture model, through our colleagues at Outcome Ingenuity, is a value supportive model. And again, this is a way to support psychological safety. So the organization and the individual are held accountable for the systems that they design and work within. This is a way that everybody gets to see how problems will be handled, and it'll be all within a learning framework. Wellness champions are key. They have to share the responsibility of moving this forward as a standard. There has to be at least one physician involved in those wellness champions, but should go throughout the organization. And this is how, no matter what we're doing, we continue to talk about wellness and make it a consistent priority and core value. At the team level, in our residency program, there were some different ways that we demonstrate what wellness focus looks like as a core value. So for instance, our small faculty core team, we explored increasing physician autonomy by a self-selected version of doing the monthly schedule. It was not without its learning moments, but again, it gave people a little bit of a better sense of control about what happens in their day, and it was a way of valuing the employees in a concrete way. We even have a Keeping It Real with Family Medicine initiative in the residency. It sounds a little kitschy, but really what it is a way of stating those transparent core values very clearly: responsiveness, empathy, accountability, and loving what we do. It's team building, it engages the patients, and it actually ensures that everyone knows what our priorities and mission is. And it even goes so far as we start our meetings off with, like what Dr. Lewis was talking about, a moment to arrive and become present. We start our meetings with mindfulness moments, and we've actually experienced where some of our biggest naysayers, when we started out, if, in the throes of the busy, we forget to start with a mindfulness moment, they're the ones that now remind us. So I think that's a good measure of success.
And so all these different things that we're able to bring into our organization are really leading us to become, to come together and have a place of alignment. And that's really what your goal for an organization or a team dynamic is. When people are aligned, really powerful things can happen. You can make a huge impact on whatever you're working on together. And that will lead to these optimal outcomes. That really is the ultimate goal. And so when you put it all together, everything that we've been discussing kind of is an algorithm that we have for everything we've spoken about, kind of our path to optimal outcomes and wellness. So it starts at that foundational level of really putting everyone on the same playing field. So everyone's starting at the same level and giving them the mindfulness and emotional intelligence training they need so they can really speak the same language. And be able to understand each other from that place and that perspective. And we do it at both the organization, on both the leadership and administrative level, and then also for the providers and the ancillary staff. And then when you're able to do that as your foundation, that allows for the psychological safety to happen and leads to natural mutual understanding. People are feeling understood. And then they naturally start to become more engaged, and that's how you get your providers engaged. They're going to want to try to be part of the solution now instead of frustrated with how things are working. And once that happens, you form these common goals and you get to a place of alignment. And so now everyone's on the same page, everyone's working together, everyone's enthusiastic about what's happening, and they want to see it work. And that's how you get to those optimal outcomes that every organization has their goals for.
So when you think about the longitudinal sustainability of a lot of these initiatives, there are things that we have already put into place and that we are committed to, and you hear from our senior leadership that it has become sort of a core value that is considered in every aspect of the initiatives that we engage upon. For example, we're doing some work with Plaintree, which is a person-centered organization, and we're in achieving the designation through that organization, part of it is compassionate human interaction training. Doing this at all levels, we've already seen that we are actually laying the standard in terms of our values for how we expect our patients, their family members, and each other to be treated. And we already see that just the training sessions alone are actual wellness sessions for our team members, because I haven't seen anyone finish those and not feel better about even their day, and then the dialogue starts to happen, and that's how a movement occurs. Our interdisciplinary team rounds, we'll continue to learn from that. We talked about our departmental dashboards. We're continuing our hospital-wide mindfulness and emotional intelligence curriculum. We're looking towards Leadership Academy. We started that, and leadership report cards, which, similar to our dashboards, will allow for the psychological safety at the leadership level, which will then allow for transparency of what expectations are. So again, all of these initiatives and the ones that come further are being integrated into a continued commitment to a culture of safety and wellness. And when we look towards an integrative medicine model, we see that when you engage in, especially here at a Safety Net Hospital, what we're able to offer our patients, understanding wellness at the patient level, as well as what our physicians need, lend themselves really well towards our integrative medicine model being a source of wellness for all as well. And I'll turn it over to Dr. Ross to talk about that.
So I'd like to talk a little bit about what actually makes us healthy. And it's actually not healthcare in our healthcare system, because we really have a sick care system of health. Actually, what makes us healthy is us. So we're given a genetic predisposition that we're born with, and what we do with that throughout our life is essential in where we go with that life. So we think that, healthcare changes life a lot, and it does, and we know that if something bad happens to you, if you have a heart attack, we will fix you. But we want to prevent that from happening in the first place. So we know now, we talk a lot about the social determinants of health, but behavior and lifestyle is a huge component of what happens to us. So it's about our diet, our exercise, and what we do to our bodies as far as bad habits and protecting ourselves safety-wise with wearing bicycle helmets and seat belts and all of those things. And then it's those social impacts. Do we have a place to live? Do we have food insecurity? And what other things affect us? Financial security affects everything about the health. So we take that genetic predisposition, and what we do with it will determine our life. Healthcare is important, prevention is important, but taking care of ourselves is even more important. So when we look at this, we look at what's called the dimensions of wellness for the patient and the provider, and it's what we like to call the personal determinants of health. So if you start at the outside of the core, the body, and the external, it's about our home and work environment. And as Mr. Flan said in the beginning, it's about, it's about family. It's about being well. And I'll talk a little bit about my personal story of what made me believe in some of the things I'm talking about. And then we go in deeper into the core and look at behavior and lifestyle. So are we eating healthy? Are we sleeping? How stressed we are? What kind of activities that we do to make ourselves happy? And we then look further in at the social and emotional aspects. Has there been childhood trauma or other events that have shaped our life? And most importantly is, what matters to us rather than what's the matter? And as a physician, I now ask that question to all my patients, and it's very different than the way I used to approach care. And why am I talking about this? I'm talking about this because I was a burnt-out doctor. So I'm a little older than some of the rising physicians here. So I've been here for 34 years, and I must admit I had really poor physical health. I was on close to 10 medications for high blood pressure, diabetes, high cholesterol, back pain, and I was well on my road to total burnout. I actually started thinking about other things I could potentially do, with the last third of my career. And I never thought I would think that way. I thought you could overcome anything, as a physician. And a couple of things changed my life. One of the things that changed my life was, finding out I was becoming a grandparent. And certainly that is hugely important for those who are grandparents. It's something that has totally changed my life and my perspective. And I happened to read a book called How Healing Works by a Dr. Wayne Jonas, who talks a lot about the integrative approach to healthcare. And looking at it as a scientist, someone who had a very evidence-based approach to care, I never thought I could have an open mind. And when Dr. Lewis and some of the team started talking about meditation and yoga, and that was the answer to healthcare, I must admit at the time, I was skeptical. And after reading the book, after finding out I was becoming a grandparent, my mind totally opened up and I changed. I changed as a person and really did say that it is yourself that's most important, and it's your family, and it's your job. And as the slide said in the beginning, and as Mr. Flans tells us all the time, it is about that wellness that's so important to us. So I went from someone who, as a provider, said there's a pill for everything, to as a person that said there's a pill for everything, and talked about nutrition. I lost 70 pounds over the past 2.5, almost 3 years, and I feel like a different human being. I used to take pills to go to sleep at night. I have long days. I have a large patient panel and administrative duties, and I would come home burnt. I'd spend my weekends working in burnt, and I found a different approach. I found eating well, exercising. I now do yoga almost every day, unless I get home a little too late, and end my day by both journaling and meditation. It sounds a little outside the box for me. For those who know me, were shocked because it was not me. I'm a very, like I said, scientific mind and treat people with evidence base. And one of the things that changed me is there is a tremendous evidence base for a holistic approach to care. The evidence base for yoga for back pain, for example, replaced my medication. Meditation for relaxation techniques, journaling, all of these things came in place of medications, and not just for me as a person, but for me as a dad, a family member, and for me as a physician. I think if I didn't make this change in my life, I probably wouldn't be here practicing in this way, because I was very, very unhappy with a lot, and the modality of this has changed my life. So integrating medicine by combining the best of prevention and wellness, by thinking outside the box of complementary and alternative techniques, by using the best of conventional medicine and what we have to keep us well into what's called an integrative approach to health. So it's all about the cultural context of health. It's all about wellness. It's all about whole health. And that's what we need to prevent burnout in our providers and for us to be better providers of care.
Great. Thank you, Dr. Ross. So now we're coming towards the end of our presentation, and we're just going to give everyone that has joined us a moment, maybe we won't say a moment to arrive, but a moment to reset. And a lot's been said here, so maybe we'll just take a moment all now to do a little breathing exercise. So wherever you are, if you could just put whatever's in your hand down on the table, put your hands on your lap, and either gaze down to the ground or close your eyes, and just take a big breath in and out. And one more big breath in and out. And now put your attention on your breath and just notice how it feels going in and out of your body. So you notice it in your chest, in your abdomen, your shoulders, and just notice what that feels like. And for many of you, thoughts may already be coming across your mind, and if that happens, just notice that they're there, and then go back to your breath and focusing on how it feels going in and out of your body. And so now bring up your own organization or your team environment, your work environment. And thinking about all the things we discussed here over the past 55 minutes, and see if anything resonated with you, or does anything spark an idea in you. How can you bring one thing to your organization or your team right now? What is one thing you can take from this that you can just start implementing right now, today? Just bring that to mind and briefly just think of how you could do that, what comes up for you, what ideas spring. And now let that thought go and bring your attention back to your breath. When you're ready, you can open your eyes and come back to the room. And so that's just a mini example of the moment to arrive that we do. And it literally can take, that was probably just under 1 minute. And you can do that at any time to reset before going into a meeting. The research shows that 47% of the time our minds are wandering during meetings and throughout the day. So this is one tool you can use to reset you at any point in the day when you have something important to step into and you really want to be fully present in that moment. So I think we'll end there. Yeah. Thank you.
Thank you. I think we're ready for questions. We have questions, so we can start there unless anyone has any.
Thank you. Thank you so much. This is Alyssa. I just wanted to thank you. That was a great presentation. We do have a couple of questions. I think we have one in the chat box, and I have a couple. So why don't we start with the question from Jeffrey about if you think there's any data or you've seen data indicating that providing leadership training to providers enhances well-being or decreases burnout.
Yes, and that's a great question. And from what I know, there is evidence. I believe that Shanafelt out of the Mayo Clinic, they had done a study, I think it was probably about 4 years ago now, where they surveyed physicians about their own burnout, probably using, I believe they used the Maslach Burnout Inventory Scale. And they also then asked them questions about their physician supervisors. So in that case, the leadership training was to the physician supervisors. And if I remember correctly, I don't have the actual data in front of me, but I believe that they saw that for every increase based on a scale they created for the physician leaders, for every increase they were able to demonstrate a 3-point or something decrease in the physician burnout scale. So they definitely showed that there were a direct correlation between improved leadership among physician leaders. That's what's allowing me to say that in front of Mr. Flans, our CEO. And they definitely showed some impact on decreasing burnout among the physicians.
Absolutely, and I believe that study is linked on the AHA physicians website that I have in the chat box under Be Well. So I'll double check and make sure it's there, but we have a resource library. I believe that it was Tate Shanafelt. It was a study done at Mayo about leadership. It looks like we have another question. How were you able to get so much leadership buy-in? And for any of you who've had the pleasure of meeting Bruce Flans, you will understand how incredibly bought in he is to this whole process. But I'll let you guys share a little bit about how you were able to get so much of your leadership team involved in this work.
So, Alyssa, you're far too kind, but I am going to give you my wife's cell phone number so you can tell her all those wonderful. So, Sabia, Dr. Aruf, our Chief Medical Officer, mentioned she's here 22 years. Dr. Roth mentioned he's here 34 years. Dr. Basillo is here about 20 years. Dr. Kamika Lewis is much younger, so she's only here how long? About 6.5 years. I've been here 44 years. But the average for our teammates is probably somewhere around 25 years. So Dr. Basillo is very fond of telling incoming residents when she does orientation for them, says, look, if you're mission-driven, this is the place where you really want to be. If you're not, you ought to think about leaving now. Well, it really says a lot because in order to work in this environment, we are in an inner city part of Queens in New York City, in a very underserved environment with a lot of challenges, certainly financial challenges, but we feel like we're really making an important difference in people's lives. But the definition of people doesn't only include our patients and those that we serve, it's also making a difference in each other's lives, all of the team members, all the 6,500 people that I'm fortunate enough to work with. So for us, it may sound corny, but I think it kind of comes naturally, but I'll let my other colleagues share their thoughts.
This is Dr. Raouf. So our secret, which we are going to now mention in front of Bruce, is whenever we have a new program that we want to start, the first person who gets trained is Mr. Bruce. Be it our compassionate human interactions, be it our just culture, be it our mindfulness session, Bruce gets to be the lucky person to go first. So we have his buy-in.
So, I mean, it really is like a family environment here, and the approach has always been about family. Like, you know, Bruce says now he doesn't know like all 6,500 people that work here, but he probably knows 3/4 of them by the name. But I think there's an openness here to listen and an openness to think outside the box that might be greater than at other places, and the fact that, you know, the leadership is very involved in the day-to-day running of this hospital. That we're kind of nimble, that if a good idea comes up, we go quickly. It doesn't take weeks or months or years to make a decision. We sit in the room and we just do it, and most of the time it seems to work out well.
Having been here starting from when I was a medical student, and clearly I've never left, there are things that you know, attracted me here to begin with and kept me here all of these years. Initially it was you know, coming into an organization where I was seeing the chair, Dr. Roth at the time, when something wanted to happen, and it was progressive, it was trying new ideas, and again, there weren't that 37 layers of red tape that you had to get through to even try an idea. That was a progressive sort of approach, and what's kept me here is really there's a commonality among all of our team members. Even on our worst days, we still share that common mission. How, you know, it's a challenging environment. So how I got involved in this wellness focus and this wellness work is things like recognizing that the psychological safety is going to really be crucial. And, you know, to be honest, I could know right now that if I had an emergency with my son, not even that big of an emergency, in the middle of this webinar, that I would be supported in attending to it, because it's not just being talked about. It really is the core value. So that's my take on that.
I think from my perspective, I found it very interesting that from the time I started here, whatever your strengths were or any potential that was seen in you was highlighted, and you were encouraged to go towards that and improve on that. And I think that the leaders here are just really into empowering their employees, and then having them also help them, you know, create the next group of people coming in, and inspire those people. So I just felt like from the moment I got here, the leadership was very involved in the younger physicians overall, and all the different staff levels. It's not just for the physicians at all. I see it in different administrators and different staff in our clinics, how if they're doing things really well and they're a really great employee, they're being promoted and they're being encouraged to do more within the organization.
So this is Bruce. So my colleagues triggered another thought I'll just share with you. So we have 3 guiding principles that I believe strongly in: trust, respect, and security. Trust is you really have to trust the people that you work with. You have to respect them, that they're smart, that they're competent, they're professionals. But security refers to yourself. You have to be secure enough in yourself that you could allow other people to do whatever they can do to their fullest potential, And I think sometimes people get a little stuck on that, the ability to allow those to be as engaged as possible, and they find that, I think, very fulfilling.
Absolutely. That's a great description. So I had a quick question. As you were talking about getting your rising leaders, and I like that term, involved, how do you select who to engage, and what's been their feedback throughout the program as you've gotten them more involved in some of these activities?
So again, this is Sabiha Rao. So I started this program about a year and a half ago. We have 2 hospitals, and at that time we were recruiting a lot of the physicians who were just graduating from their fellowships. Many of the physicians obviously had many more options to go to in the New York area, but they came to us. And I thought it was a great opportunity to see what their priorities are, because they will be different from the rest of us who have been here in this organization for over 25 years, and engage them. And at the same time, I think the blend of this new generation plus our experienced physicians was a great blend for the survival of our organization. So it has been a great experience. We have about 30 plus physicians from both hospitals, from all different subspecialties, who get an opportunity to engage with each other, know physicians from the other campuses, get to brainstorm with each other. And then there are certain things that they have identified which were weaknesses in our system that I get my leadership to be engaged with them. And we don't just listen to them. By the next meeting, we have solved many of the issues that they raised, and they really feel engaged and part of the system.
And this is Kamika, I just wanted to add to that. You know, when I first went to it, I wasn't sure what to expect, and I actually called Dr. Basello after and said, you know, that was amazing, because I honestly didn't even know all the new physicians that, or even ones that had been there as long as me. I didn't know them very well, because sometimes there were different hospitals and we're completely different departments. So it was great to see people that, you know, had graduated around the same time as me, and I was actually like inspired and excited to see that all these, you know, these people were there as well, and we felt really supported, that the organization really cared to hear what we had to say, and it definitely increased how valuable I felt within the organization.
And it's a win-win situation. So during those forums, they get to tell us about their interests, like Kamika mentioned about her mindfulness training and how much. So we take advantage of her. She likes it because that's her interest, but the rest of us benefit from it. We have a young physician in the ER who is into community service, so she has done outreaches here in this area, which is helpful for her because that's her interest, and at the same time, it's wonderful for our organization.
So I have a favorite expression that I'd like to explain to you. So I call it exploiting people to their fullest potential. So exploitation sometimes has a negative connotation, but in our organization it's very positive. If people have the potential to do something, why not allow them to do it? And just like we said with Kamika leading the Search Inside Yourself program, the mindfulness training, or so many other examples of that.
Well, thank you so much. I really appreciate you taking the time to share the both the amazing culture that you've built at your organization, and then the ways that you've really looked for solutions that don't require a huge amount of investment and years of committees and so forth, and really are getting to how can we make this the best place for our patients and for our team. I'm just really impressed with the work that you've done. So thank you so much,
Alyssa, for those kind words and for coordinating today's presentation.
All right. Well, thank you for joining us, and we're adjourned.
Thank you.